And joining us in the studio for more on the subject is Eileen Quinn, Director of Advocacy and Communications with the Center for Vaccine Innovation and Access at PATH. Ms. Quinn, welcome to the show.
Thank you very much for having us.
So let's start with the good news, reduction in diarrheal diseases. To what do we attribute this?
Well, first of all, I think it means that when governments spend money on improving public health, the children win. So we've invested in better access to clean water, better sanitation, ORS and zinc, which treat diarrhea, and vaccines. And the combination of that, along with nutrition, has helped bring down deaths from diarrhea.
So what other findings were perhaps unexpected or surprising in the report?
Well, as you pointed out, the really serious problem now is that children are having recurring infection from diarrhea. A child under 5 may be sick many times a year. Each time, their stomach lining is deteriorated, and then a child isn't able to absorb the nutrients that they need. Then the brains and bodies of those children don't develop as they should. And so really, their childhood diarrhea limits the rest of their lives.
And some of the avoidable causes, we talked about water and sanitation. Can you tell us a little more about it?
Well, we definitely need to improve access to safe drinking water and sanitation across the continent of Africa. And I think governments are trying, and what we need is more support from the global community for national governments who recognize this problem for their children.
So if we are looking at some cost-effective solutions that could be implemented in developing countries where resources are scarce and solutions are challenging to come by, what would you say could be some very basic cost-effective solutions?
So there's a lot of great new work that's been done on point of use or point of community water filtration. Really excellent work that's being done on sort of sanitation entrepreneurs who are finding ways to address community waste. And actually, vaccines are the most cost-effective health intervention that a government can provide to their children. So a combination of integration, water, sanitation, vaccines, nutrition, that will do it.
So in terms of advocacy, when we approach governments, how do we frame the message to ensure that water sanitation is really one of the priorities on the agenda with regards to financing?
Well, I think the issue is that the children, their families, and their communities are stuck in a cycle of poverty unless we make these investments. So these investments are really for the future economic prosperity of a community and of a country.
So moving forward, when we look at the Sustainable Development Goals, I mean, diarrhea and waterborne diseases are definitely part of the big solution, you know, when we look at the health. Now, when we move forward, what are some of the priorities areas that will be key in ensuring sustainable sanitation solutions?
Well, I think a financing mechanism is really important so that governments can think about the best way to make this happen over the long term. And as I said earlier, some private sector solutions and community-based entrepreneur sanitation solutions have a lot of promise in addition to governments thinking about how they can provide better access for their populations.
And quickly, what do you hope to accomplish after this report is released?
That no child should die of diarrhea and that no child should suffer lifelong effects from diarrhea.
Eileen Quinn, thank you so much for joining us.
Thank you.
And that was Eileen Quinn. She is Director of Advocacy and Communications with the Center for Vaccine Innovation and Access at PATH.